Ladies and gentlemen, welcome to the Safety and Risk Success podcast. I'm your host, Christian Harris, the founder of Slip Safety Services, and I'm joined today by Sarah Jane Brown of Cornwall Council. Sarah Jane is an environmental health officer by trade. As she tells us, she's been doing that job for a number of years for the council, and we talk a bit about that and some of the trends that she's seen and some of the particular challenges or issues that she has to deal with in Cornwall because of tourism and so on. And in the last 18 months, because of COVID, she's moved across into being responsible for the council's COVID response. So the first half of the podcast is talking all about that. So what has COVID meant? What are some of the good things and the bad things that she's seen? What's been the attitude of the council in terms of enforcement and how many enforcement notices have they had to produce, etc. So some really interesting topical stuff. And the second part of the podcast is all around slips and falls, because Sarah Jane was involved in a serious slip and fall case, in fact a death, back in 2015, which I was also involved in. So we unpack that a little bit without going into too much detail, which would be perhaps overboard, but we talk about some of the principles, we talk about why that accident happened, and why a prosecution was sought, because this accident did result in a £400,000 fine for the co-op, which is where the incident occurred. We also look forward a bit as well, and think about if there's such a thing as post-COVID life, but sort of going forward and thinking about the health agenda and how important that is going to be moving forward, both in terms of physical health, but also mental health as well. I hope you enjoy this episode. I certainly enjoyed meeting and chatting with Sarah Jane, because I've used a quote of hers many times over the years, which is all about signage involved in slips and falls, and signage alone not being an adequate control measure. So it was good to actually get to talk to her rather than just be quoting her willy-nilly. Anyway, let's join the conversation with myself and Sarah Jane. As always, if you get value from this, please hit follow, please give us a review, because that's really helpful and beneficial. Hope you enjoy it, and look forward to seeing you again next time as well. Cheers. Sarah Jane, welcome to the podcast.
Thank you very much. I'm pleased to be here.
Yes, me too. I just told you this off before we started recording, but I'm a bit starstruck because I've used your some of your quotes and things many times over the years. So, but we'll get onto that a bit later. But it's great to have you on.
Well, thank you very much.
Would you like to start just by giving a bit of background to the audience in terms of who you are and what you do, and perhaps some of the things you've done in the past in terms of some of the different roles that you've had?
Yeah, definitely. I actually work for Cornwall Council, so I work in the Public Protection Department, but most people basically know it as environmental health. So I've joined in 1998, so I'm coming up to 23 years with the council now. Fair old long time.
Yeah.
Primarily through that time, I've worked as a health and safety inspector. So my role's been to go out. I have the real fun job of going out and criticising what all the health and safety consultants and everybody else does, which is great. And I can do it with hindsight a lot of the time. So I go and investigate serious accidents that have to be reported under RIDDOR, follow up on complaints from members of the public. In Cornwall, we get an awful lot of tourism. So it might be hotels, guest houses, that type of thing. And also do a certain number of inspections. At the moment, I'm actually leading our COVID enforcement team. So, I think we all had quite a dramatic change 18 months ago when COVID struck. The sort of normal day job went out the window, and we were fast trying to interpret the COVID regulations and help businesses get that right. So, and also I do a little bit in our pollution team. So I work on nuisance, environmental crime, and a little bit of dog warden. So I've got my fingers in quite a lot of pies, but I guess sort of my home is always health and safety. It's something I've done for many years. Had quite a few sort of high profile cases, but also, you know, very proud to work with a lot of businesses and hopefully without enforcement help them get it right and improve their health and safety for the safety of those visiting and working there.
I think that's a bit of that job that's often underappreciated or misunderstood, but actually, you know, there's a collaboration and a partnership approach to try to improve. It's not just about, you know, something terrible's happened and we're going to throw the book at you.
Very much so, and I think it has changed over the years. You know, when I first started, there was a little bit of that. You know, you went in, you could nitpick, you could pick holes, but certainly, particularly in the last 10 years, it's changed very much to supporting businesses. Our primary aim is that businesses get it right, that we don't have accidents. You know, the last thing I want to do is go and investigate a fatality. I want them to get it right before it gets to that stage. Obviously, Cornwall Council have got quite a lot of primary authority partners, and that's one of the ways that we support businesses throughout the country. But equally, you know, a lot of the work we do now is preventative webinars, all sorts of things to ensure that businesses know what they should be doing. But equally, we've got to make sure there's a level playing field. And if there are businesses out there that aren't conforming to the laws, are taking the mickey, then the enforcement approach is needed to make sure it's fair for everybody.
Yeah, absolutely. Yeah, it was interesting you said about health and safety and the ability to deal with hindsight or have that perspective of hindsight, whereas what you're doing now with COVID, I guess it's settled down a little bit compared to what it was, but thinking back sort of 12-18 months, you know, the goalposts were changing constantly, and very, very difficult, very, very different experience, I imagine, to try and juggle all of that versus what you had been doing.
That's it. I mean, with the health and safety law, we work with the 1974 Act. A lot of the regulations, things don't change. You know, we know it all inside out. We work to that. With COVID, you know, we'd arrive in one morning and find a whole new set of regulations had come in. Businesses were asking, you know, well, how does this affect us? And we don't know ourselves. You know, all the businesses seem to get the impression that the government let us know, consulted us, but basically usually at the same time the businesses saw the regulations at the same time we did. And, you know, we were busily trying to interpret them. And as the people that actually had to enforce those regulations, sometimes make decisions on things that were quite grey. I'm quite proud of the way Cornwall dealt with that, because we did, you know, we made those decisions and, you know, we didn't leave businesses sitting on the fence, or, you know, we were able to say, well, we are the enforcing authority. This is how we're interpreting it. If you do it this way, you won't be in fear of any enforcement action.
Was that an area where the primary authority scheme covered that? So in other words, you know, one of your clients had a business in a site in Manchester, and the Manchester interpretation was a bit different to yours, or
No,
did COVID not cover that?
Primary authority never covered COVID, so there was a sort of set areas that they covered. It didn't actually stop us giving our primary authority partners information, helping them and supporting them. But for example, if somebody wanted to serve a COVID notice in relation to one of our primary authority partners, they wouldn't have to seek our approval or let us know that they were doing so prior to it happening.
Yeah.
And actually, most of our businesses, I don't think there was anything that was too badly impacted by COVID enforcement. Hopefully, you tend to find, because primary authority partners have gone down that route, that they are usually very regulatory aware and trying to get everything right.
Yeah. Just for context, if anyone isn't aware of primary authority scheme, you can correct me, but I'll try and give a summary. I did interview Dave Lovell, who was quite heavily involved in this at Bays, so that's another episode people could listen to. But basically, you can have an arrangement with a local authority whereby they will, in simple terms, sign off on your health and safety policies and various other types of policies, and that means you've got kind of more certainty of the way you're doing things, even if you're a national business. And as I understand it, it means that where there are or can be some slight interpretations of different things, that the local authorities in the different areas will defer to the primary authority partner. So it just makes life a bit simpler for you as a business.
It definitely gives a consistency across the country. And, some of those big businesses, you think of the big supermarkets that are in every sort of high street or every town. They want to have a consistent approach to the way that enforcement officers are coming in to treat them. And that primary authority partnership really helps that for them. And, the good primary authority partnerships, we do really help them grow and understand their regulatory obligations and improve their systems. I think Cornwall, I've got a feeling we've got about 38 partnerships, might be a few more than that now. It really is a good working relationship, and we've got people dedicated to those partnerships now.
Yeah, oh, great. So you said that overall it's gone pretty well in terms of the COVID response. I mean, were there any sort of periods where I imagine, because of, as you say, the heavy tourist nature of the county, probably the summer was a bit of a pinch point, was it? Because people weren't going away, so there were a lot more people coming to Cornwall.
Yeah, Cornwall has been crowded because simply, we are one of the most popular tourist destinations. We've got the most beautiful coastline and countryside. But with the travel bans or the difficulty of getting in and out the country, we found we had a huge number more coming into Cornwall. And then we ended up with both COVID and health and safety problems. So, you've got areas that we're actually trying to reduce the amount of people in certain areas or make sure they've got room to distance. And literally our town centres, the likes of St Ives, Lou, people are side by side in the streets simply because of the amount of people that are in the streets. And then that leaves some people uncomfortable, not having the best experience. Alongside that, our hospitality is struggling to actually get people to work in hospitality. One of our primary authority partners, which is a brewery, I've got a feeling they were something like 30% down on the staffing that they actually needed.
Wow.
Simply because that staffing isn't available alongside Brexit, with people not coming in, there's more jobs available. So it's been a really sort of difficult summer for us, and the whole sort of COVID period with the holidays. So even in the first lockdown, we've got probably 20,000-30,000 accommodation providers, probably a lot more than that. And, we're constantly having complaints that people are operating illegally, that they should be locked down. Well, obviously there were certain exemptions that people working could stay.
Yeah.
But then people might come down and say, well, I haven't got the IT facility to work in London anymore. I'm bringing my computers into a holiday accommodation. And you've got to make judgments on whether that is meeting the legislation or not. And we had some quite sort of tricky conversations around certain things, and even sort of we had one that were coming down to do some filming on a magazine article, which was a relevant exemption, but then they had a house party in the holiday accommodation, and you just end up sort of putting your head in your hands, and we've seen sort of every excuse, every sort of ways sort of trying to jump around it.
It's interesting.
In the initial time, we had a good 20 staff just working with the COVID. And I think over the first year, we've had 9,500 service requests, either related to places that shouldn't be open, or help and support, or concerns, complaints. So, we've been absolutely flat out on COVID. Yeah,
I can imagine. Yeah, it's interesting how I think the vast majority of people have obviously complied pretty well to everything, but there was always some people who seem to think the rules don't apply to them.
Yeah, and what we've served, I think it's 8 fixed penalty notices in the end. So that's one of the we've got an enforcement sort of protocol. You can serve improvement notices, restriction notices, and fixed penalty notices. Well, a couple of pubs and community centres, or one sports club, we found them in there drinking during lockdown, television on, drinking, and often sort of the more vulnerable groups as well, not always the sort of teenagers, but the older generation. So, for cases that are as serious as that, they have gone straight to fixed penalty notices. And I think we've had £8,000 fines on businesses, which have all been paid without any appeals.
Yeah. I saw something, I don't know why I'm chuckling because it's not really funny, but it was, I don't know if you're into football, but it was Jamie Carragher, who's a ex-footballer and now a pundit, and he was saying that he went to a pub in Liverpool during the time at which pubs could only be open if you were serving food, and he said basically it was full of plastic pizzas on the table, so like everyone was having a drink.
Yeah.
And
we had the same. You could buy a beer and you had a baked potato with it, and of course the government had said you must have a substantial meal.
Yeah.
But there was no definition of what a substantial meal was. And I mean, we had our best legal people trying to work out what a substantial meal was. And it's, from an enforcement point of view, you don't take action against somebody that, there's a question in the way the law is interpreted.
Yeah, well, I suppose you could even argue that, going back to health and safety, what's reasonable and what's practicable, those are all sort of open to, obviously there's a lot more case law and the definitions of those things are much more understood, of course. But is a sandwich a substantial meal? Well, many people would have a sandwich for lunch, so therefore it probably is. I don't know, but
luckily Cornwall were only 10 days in that particular period of whatever category. I think that was category 2 at the time, because we went up quite quickly, so we only had 10 days of trying to work that one out. That was quite useful. Going back to football, we found the World Cup quite a trying experience as well, because that was in the time that everybody's meant to be sat in the pubs.
Yeah.
And we very much sort of follow, like the police did, the sort of 4 E's, which is engaging, explain, encourage, enforce is always the last option. And I think we were quite sort of sensitive, but a couple of videos came out and we did fine a couple of pubs. But literally, I've got a video of probably a fairly small, quaint old pub with everybody on their feet, standing on the tables, cheering, arms around each other, no masks on. And I mean, 2 meter distancing, you were probably lucky to get 2 centimeter distancing.
Yeah.
So, there was just no effort there, and that was the pub's own CCTV, and at one point the manager's joining in with them.
Yeah, because obviously you can do certain things, but you can't do everything to control humans in that setting, can you? You can't force people to not socially distance.
We just need to see that they are trying to do everything within their powers, and then we have sympathy for when England were doing so well and scoring a goal, if everybody leaps up and there's a few hugs, we're not going to come down and rattle their cage.
No, exactly. Yeah, exactly. So where would you say, across that experience then, you've seen the sort of examples of where, on the whole, people have been doing it well, or are there any areas where, on average, that these tend to be the areas that companies perhaps could improve a bit?
I think in the early days, one of the areas that wasn't recognised enough was the standard of ventilation. I mean, that's something that's sort of really key to us now. And as a team, we've actually got carbon dioxide monitors and actually using that as a tool to help us assess ventilation. And I think that's something in the early days, everybody's wearing their masks, washing their hands, but particularly in the sort of chilly spring, everything was still, when the people were allowed indoors, everything was shut up and the ventilation wasn't great. And certainly I was in a government meeting the other day that they reckon it makes up to 70% difference indoors if there is decent ventilation to as if all the windows and doors are shut. And of course that comes with challenges itself, because a lot of our licensed premises have certain conditions on their license which says you must not cause noise, you must have all windows and doors closed. So it does come with challenges that we're trying to sort of address and be a little bit sensitive on. But we had a lot of premises that were trying really, really hard, and some really sort of good examples, meetings that were sort of moved outdoors, just the ways of working and the care that people took, and some of the hotels and some of the cleaning regimes. And I think a lot of it was all about communication. I think that was the thing that was most underrated, particularly again with the tourism sector. If the hotels and guest houses were communicating well with their guests, they knew what the expectations were, they knew what they could and couldn't do. You know, because we've got a real mix of people with COVID. We've got some generations and some different people that are really concerned, really worried about it, want reassurance. And we've got the others that, you know, it's just one of those things. I'm of the age that if I get it, I'll probably be absolutely fine. I'm not too concerned. And it's trying to mix those people together and make sure that they can all understand expectations and meet the sort of criteria. And the same for the staff. So, you know, there's been some really sort of positive stories out there.
Yeah, I mean, my family, we're sort of, if you said, you know, 10 out of 10 cautiousness and 0 out of 10, we're pretty high, because our youngest son has got asthma, and he's actually been in intensive care a couple of times, you know, with pneumonia and things. And so obviously when it all kicked off, you know, we were incredibly cautious, and effectively we were shielding, even though he wasn't on the official shielding list. It now turns out, or it seems to be the case, that childhood asthma isn't such a big risk factor, so we're sort of being a little bit less cautious than we were, but I think we're still very much on the more cautious side of things. And I think you're right about communication. You know, it's, so for us, it's meeting up with friends, while explaining, if they don't know, you know, this is the reason that we're being very cautious, or whatever it might be. And I think I suppose that's you know, there's always every cloud has a silver lining, and of course we're not you know, downplaying the terrible losses and issues that COVID has caused, but you know, if it helps us to improve communication, and it helps us to improve cleanliness, and it helps us to improve, you know, various other things, then I guess we've got to take some of these positives from it.
Definitely. And I think with sort of health and safety, we've always looked at the physical hazards, but probably the health hazards is something that's not always been as high on the agenda. And I think that will be a sort of permanent change now, that everybody will be a lot more aware of, you know, the environmental factors and the health factors that are out there.
Yeah, the whole sort of ESG agenda is gathering a lot of pace, isn't it?
Definitely.
I was listening to an interview with Prince Charles earlier about, you know, the environment, and a lot of it was kind of him being proved right for all the stuff he said 20, 30, 40 years ago that people thought was a bit weird, and now actually it's kind of everyone's turned around to being on his side of things. What are you expecting, other than that sort of health agenda? Are you expecting any other kind of trends to be more or less important if such a thing exists as a post-COVID world, but sort of, you know, moving over the next few years?
It's interesting, isn't it? Because I still don't think we know. I think we've got this winter to get through. I think there's a lot of sort of unknowns ahead still. I mean, the government have been consulting on sort of Plan B and COVID passports and potential for that type of thing. You know, it's a really difficult one. We didn't even imagine COVID 18 months ago. And I'm still not sure if another variant appears or if there's another sort of health emergency. I think we probably need another year to settle down before we really can anticipate what's going to happen ahead. But I think it is just the general health type agenda will be sit with health and safety. Safety has always been the big thing. The health bit, you know, we've a lot more ignored that element of it. I know we talk about it when we're talking about things like concrete dust or bits and bobs like that, some of the COSH chemicals, but you know, this now affects everybody in every business environment.
Yeah, and I think and mental health as well is obviously another one that you know, what's the effect of being cooped up in your house and away from people, and you know, how do companies deal with that going forward, I think is a really big thing as well.
Definitely. You know, I know it in the people that I manage, we've got people that are really quite happy at home. They don't, you know, because they're quite high on that scale of COVID concern, they don't particularly want to go back into an office and meet everybody else up. I mean, particularly at the moment, you know, it's probably cases are really high again in Cornwall. We know it's generally in the schools and coming into the household, so a lot of the team have children. So actually, even the really sort of responsible people could be carrying COVID. But equally, we've got some people that are working at home that are really lonely, are really missing their colleagues' input. And it's how you balance that up and how you get everybody, certainly in environmental health, we've got a lot of really burnt out people at the moment. We're probably one of the unappreciated key workers. We weren't doing anything sexy but we were working really hard and really long hours for the period of the pandemic.
Yeah, and it never stops, and it never will stop. Yeah,
never will stop. But we've now got a backlog of food inspections, of health and safety incidents, of all the things that we couldn't do because we were doing the COVID that are now built up to, that we've got to get stuck into. So it's not time for a break or even an easier time.
No, and in the context of certainly over the last decade anyway, a reduction of funding as well.
Yeah, and I mean, again, Cornwall Council just put a recruitment freeze into the council because of the overspend related to COVID and all the services we've had to do. We've got quite a number of vacancies within environmental health which we're going to be unable to fill, which is putting more pressure on the people that already, been working really hard for a couple of years.
Yeah, as you say, I agree with you that we can't really, it's got to be another year until we can really make any kind of judgment, because I am concerned about another lockdown, for example, over the winter. I'm really hoping it doesn't happen, because I think the effects of lockdowns are devastating in all sorts of ways. So let's hope we don't need to do that, but obviously if we do,
I think it's unlikely. I think the hospitals now can treat COVID so much better, even if they're getting a few people through the doors. But I think where we've got to be very wary is if there is another variant that pops up that isn't so susceptible to the vaccination.
Yes, yeah,
that will change things quite dramatically, quite quickly.
Yeah, it does seem. It does obviously seem that the vaccinations are having an effect on clearly the hospitalizations and the serious injuries and the deaths. I was reading something about, I think it said about 1/6 of all of the most seriously ill patients over the last 3 or 4 months have been unvaccinated pregnant women, for example, who I guess have been nervous about getting vaccinated because they're pregnant. So if we can sort of just keep encouraging vaccination to continue it, hopefully that will help. As you say,
and I mean, it's something we're working very hard as an authority to get the communications out there. Our comms team, we also employ a number of COVID advisors that actually walk around the towns, hand out leaflets, take lateral flow tests to businesses, and really just encourage the vaccinations as well, because as you say, that is key into sort of controlling it. And whilst people can get COVID with vaccinations, it's rare for it to be as serious.
Yeah. What sort of percentage are you hitting, do you know, in Cornwall of people vaccinated?
I wouldn't have that off the top of my head, and I don't, it is something that we look at, and we get hospital data reports twice weekly, but it's not the figure I've got in front of me at the moment.
Yeah, I live in.
Yes, it will be wrong.
Yeah, I live. I don't know the exact percentage for where I am, but I live in Lewisham in London, and the percentage of vaccinations is quite low. Although interestingly, the cases have always been low. It's a weird thing that we don't seem to have suffered the very high caseload or serious issues with it, but yet the vaccination percentages have been low as well. So I can't quite square that circle, but
certainly vaccination wise, I think we're around 89% for the over 18s have had one vaccination. Something like 83% have had both. Yeah. And we've certainly noticed the difference. So when the vaccinations were coming in at the back end of the summer, we had a lot of cases in the hospitality, which were generally employing the younger age group that hadn't had 2 vaccinations, and most hadn't had 1 vaccination. Yeah. Whereas now we're seeing a lot less COVID in the businesses. It is generated from the schools. So it's generally the school children that haven't been vaccinated yet, bringing it home and then being in such close contact with parents that even if they are double vaccinated, they are getting a milder, usually, version of COVID.
Yeah. something that I've spoken with a few people on the podcast about, and if you don't want to answer this, feel free, but is that I think there was this kind of fear or expectation from certainly the insurance industry that there was going to be this tsunami of claims against employers to, you know, to say, oh, I caught COVID and it's your fault, Mr. Employer. But that hasn't happened yet, and it doesn't seem like it's starting to happen anytime soon. I mean, do you think that that's likely, or do you think that from an enforcement perspective, you know, there's going to be any chances of that, or do you think it's most likely that, you know, everyone's...
There is a rare chance of it. Ultimately, it's always going to be virtually impossible to prove where you've actually caught COVID. So, you know, you could have caught it from the petrol station, you could have put your hand on the petrol pump.
Yeah.
You know, to prove you've caught it from the business, unless perhaps you're in a care home and you're a vulnerable resident. But then, even providing they have done everything reasonably in their power, you know, I think it's unlikely that you're going to get too many cases or anything like that. Now, obviously, if you go to somewhere and you know, somebody, for example, has come into work and say, I'm not feeling very well, and somebody said, well, carry on, you know, blah, 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 and it's in a care environment or something like that, there's potentially a case there, but we haven't seen that.
No.
And, you know, I think it's very hard to actually pinpoint where you've got it, and certainly most businesses are trying really hard.
Yeah, that would be my experience as well. I think from what I've seen, people are trying their best. So long may that continue.
Long may it continue, and you know, it's just continuing to try and get some of the things in place. You know, a little bit of distancing, the really good ventilation, and just the sort of sensible numbers. Yeah. I think that's it, isn't it? It's we as you said as well, we know a lot more now, so we start to see that these are the important things. Whereas when it started, it was, you know, do we wear masks or not, and cleaning and hand space and space. I'm quite interested. We were doing a little bit of research in the last couple of weeks, looking at the cinema industry, particularly with the Bond films coming in, because obviously you're now getting quite a lot of people in a relatively small space. But what the cinemas generally have done well is put some good ventilation systems into the cinemas, and at the moment we've got very little, you know, we follow up a lot of our cases with our public health team, we work very closely with them, and they've got very little that we can associate with any cinemas at the moment. So, you know, it just shows those people are generally pointing in one direction, so they're not face to face. A lot of the cinemas are still sort of putting a gap between groups. And they've got good ventilation in, and generally with those, most of the people will be double vaccinated again. You know, we haven't had cases like that. Equally, we had a big festival back in the summer in Cornwall, and we had over 5,000 cases associated with that. That was outside, but it was a very different environment with people sharing sleeping accommodation, you know, really pleased to be out with friends, a lot of the unvaccinated demographic, and it went around really quickly.
It just shows you getting the basics right makes a difference. And it's interesting, isn't it, for parallel to the world of health and safety, where get some of these basics right, and you can avoid these big problems. And well, let's shift gears and talk a bit more about health and safety then, because we haven't spoken properly until today. We've exchanged some emails, but I mentioned I was a bit starstruck. That's just because we were both involved in a quite high profile slip case a few years ago, although we didn't meet, and you know, I was a relatively insignificant thing of coming in on behalf of Co-op and sort of giving them a view as to what had happened. But I've talked about this before, and I've talked about it on the podcast, but it was a gentleman called Stanley May, who was in the Truro Co-op store and slipped over on some water on the floor, and banged the back of his head, and unfortunately passed away. And I got a call sort of from somebody saying, oh, we need to meet up, but I don't really want to talk about it over the phone. It was all kind of a bit hush-hush, obviously, because it's such a tragic incident. And long and the short of it was that resulted in quite a big prosecution which you were involved in. So I was interested just to talk to you a little bit about that and get some of your sort of perspective on that, really. I mean, taking a step back from that incident, you've obviously, as you said, you've been involved in health and safety for a number of years. I mean, how big a problem, you know, from your perspective, is slips and trips, you know, overall over the years from what you've seen?
Certainly slips and trips is probably the most common cause of accidents that we see, and the most common cause of RIDDOR reported accidents. So that is serious accidents. Now, generally, it's very unusual for somebody to die as a result of a slip or a trip. But obviously, this particular accident showed what has the potential to happen. And, you know,
I don't know how to respond to that.
Excuse my watch. And, you know, with the best will in the world, people downplay slips and trips. Oh, we just stumbled over, somebody slipped down those steps. But ultimately, I feel very strongly that workplaces and businesses have to be very aware of some of these things, because, you know, somebody may just stumble down those steps or trip over where there's a little bit of moss on the access to the building, but next time it could be somebody that slips or trips and that does hit the back of their head and has a serious injury.
Yeah.
And, you know, over the course of the years, you know, I've probably had 5, 6, 7 accidents where people's lives have been changed by a slip, trip, or a fall. Only the one fatality that in Cornwall that I've dealt with, but, you know, we've had others that have had slight brain injuries.
Yeah.
We've had others that, you know, have had to have hip replacements, never been able to walk quite as well again. All of those accidents could have been prevented. You know.
Yeah, I always say it comes down to luck, or more specifically bad luck, because, you know, you or I could walk on exactly the same piece of floor in exactly the same condition, and, you know, you might slip but stop yourself from falling because you've got better balance than me, whereas I might slip and bang my elbow and break, you know, suffer a break, or we might both slip and fall, but I just twist slightly and it you know, I hit the side of my head, or I fracture my wrist, or
I might have a different pair of shoes on. You know, I might have an outdoor walking boot, you might have an indoor shoe, which on that type of floor, you know, the indoor shoe might be better, who knows. But in this particular instance, it was quite a flat shoe that the deceased had on, and, you know, it was a area that people had walked through for a couple of days that had been wet, and, you know, he was the first one that had a serious incident. You know,
and that was the crux of it, as I understand, that it was not so much, you know, had the fatality happened and somebody had, you know, spilt a bottle of Coke on the floor 30 seconds before, then that would have been obviously very tragic, but, you know, something that probably was not so avoidable. Whereas there was a leaking chiller or something, wasn't there? And there was water on the floor for a long time.
There was a leaking chiller, and it is not uncommon for supermarket chillers to leak. I think we've seen it in most supermarkets. But with this particular one, it had been leaking for 48 hours. And every time it went through its defrost cycle, it would pour water out over the floor. It was beside the sandwich area, so a particularly busy area. And they hadn't taken adequate control measures to ensure it was controlled. So for that, you know, yes, if it had been the first time it had leaked, it would have been unfortunate if it hadn't been reported. But the crux of the case, as you say, was the fact that for 48 hours it had been leaking and they hadn't taken adequate measures to prevent that contamination spilling onto the floor. The floor was your typical supermarket floor. And I think we all know, because they have to be very hard wearing for the trolleys for the footfall, that if they're contaminated, they can become very slippery very quickly. And that's what happened in this case.
Yeah. And I've used a quote of yours a few times, several times probably, it's fair to say, which was, I think, summing up the case and basically saying that, you know, what people need to understand is that putting a sign out, I'm paraphrasing, just putting a sign out isn't enough. You know, you either need to be, if floors are wet, you need to be making them dry, or you need to be stopping people from walking on them when they're wet, or making them sufficiently safe to be walked upon when they're wet.
That's it. And I mean, we've had other cases, similar sort of environments where it's absolutely raining cats and dogs, and people walk into supermarkets and they're trading that water in with them. And again, you know, supermarkets need to think about having suitable mats that will absorb that water so that the contamination doesn't come in.
Mm.
You know, with the prams, with the trolleys, with the footfall, that can be another area that we've had some really nasty slip accidents.
Yeah, I think there's a challenge of people's perception of what's a wet area and what's a dry area. So I think if you said to somebody, you know, is a swimming pool a wet area or a dry area, they'd of course say it's a wet area. But then if you think about an office reception floor or a supermarket entrance or a shopping centre entrance, people's assumption is, oh well, there's a mat, it's not a wet area. But unfortunately most mats are just not deep enough to do, as you say, to what they're supposed to do, which is to dry the feet or the pram wheels or whatever off.
And I mean, one of the other really interesting areas where we can have a lot of serious accidents is kitchens.
Mm.
You know, particularly if you start to get, you know, a lot of places have really good floors, but as soon as you start to get oil onto it, or you haven't got suitable cleaning regimes, you know, those floors can become very slippery very quickly.
Yeah.
I've investigated 2 or 3 accidents over the years where chefs have ended up putting their arm in a deep fryer.
Yeah.
Simply because they've slipped and put their arm out to support themselves, gone straight in the fryer.
Mm.
You know, and I've walked into a few kitchens and I've literally sort of skated through, and you know, it's clear sometimes that the cleaning regimes in those places just are not sufficient to, and you know, if you do clean down properly at the end of the day and grab any spills as they happen, that shouldn't be happening.
Makes a difference. Yeah, it does make a difference. Yeah, and there's a lot of data to support that.
I mean, I can remember one kitchen, and I was even in the corridor outside now skating before I got in the kitchen, where they'd brought contamination out. And I mean, we actually asked them to shut down that night and clean it before they carried on.
Yeah, I can remember a shopping centre in Leeds where the operations manager, I think he was, of the shopping centre, broke some bones in his neck. You know, very lucky that it wasn't worse, but he slipped over in a service corridor outside the back of some of his tenants' restaurants, where basically they hadn't been cleaning their floors very well. They've been trafficking the grease into the corridor, and he's slipped and suffered this very, very serious accident.
No, it really is. You know, it's not just having the good floor, but it's looking after the contamination that gets on there, and that's generally, you know, organisations, particularly the sort of bigger buildings, do the floor quite well, but sometimes on a local level, it's not looked after like it should be. Yeah,
I mean, would you say, obviously this was 7 years ago now, would you say you've seen an improvement in how these things are being dealt with, without obviously talking about anyone in specific terms, but you know, overall, do you think that people have taken heed of some of the stuff that you said and we've been talking about today?
I think they have. I think, like everything, there are some organisations that do it better than others, and that goes with supermarkets and everything else. I've certainly not seen anything in the way of problems with co-op since, but I have still had to take some supermarkets to task. And some might be, it's not necessarily chillers, but they might have a leaking roof that they don't address quickly, but yet they know every time it rains that it will leak at that point.
Yeah.
And actually, is a bucket that somebody's going to trip over much better than a pond on the floor? You know, they need to shut those areas if they cannot control the contamination.
Yeah, that's the thing that I would say I don't see enough of, is where, you know, they know that these floors are getting wet and they're not closing them off for whatever reason, and that does frustrate me, because obviously I know as you do what can happen, and there's this kind of perception, isn't there, that slips and trips are not that serious, I think, and so people think, oh, it's fine, you know, even if someone slips it'll be fine, but and many times of course it is fine, but in the grand scheme of things, but but
I think
sometimes
we
it's
underestimate how much the human factors are at play. And I mean, I won't say which supermarket, but nothing to do with the case. But there was one particular supermarket that I've always had a little bit of an issue with, you know, and they didn't do very well with contamination, or even sometimes rubbish, you know, would be in that particular store. And I was banging on about it. I spent, unfortunately for them, I happened to shop there as well as be their regular later in the area. But it was very interesting after a couple of years. And I mean, I spent a lot of time, and there weren't really substantive improvements. When they saw me coming, they'd suddenly do whatever was needed. But
yeah,
that particular, a new manager came into that store, and the problems disappeared within 3 months. Funnily enough, I had a new store that had similar problems, and I quickly found out that that same manager that had been in the other store had moved stores. And I think we don't underestimate sometimes the human factors that are at play sometimes with these types of problems. And
I think
if the person at the top can, you know, and I've been in stores with managers walking around, and they see a sweet wrapper out of place and they're picking it up, or they're asking somebody to deal with. And I've walked around with managers that are walking past problems. And it's that type of attitude that comes from the top that has a huge impact on some of these big supermarkets that have 200 or 300 staff.
Yeah, you must have seen that in you know, in hotels. So, you know, you go to these 5-star hotels and the general managers are just meticulous about that kind of thing. And you just know that if you transported that person into a supermarket or a shopping centre or whatever, it would just uplift the whole experience and standards and safety levels, because they really care about it and they can see it's important, and that does drive improvement.
I'd say with the hotels, there's always 2 factors for me. There is that front of house, but I also like to see, say, where the chef are keeping all their whites, or the staff room, and if that is equally as good, I probably, on those 2 factors, I can say that I'm not going to spend a huge amount of time in that hotel because they're meticulous. But I've been into some really top hotels, and you've looked in the areas where the staff are asked to have their breaks and things like that, and their locker areas, and you look at the standards there, and you know, it can impact on the rest of the behind the scenes.
I remember a few years ago, I wasn't there personally, but my team were doing some work, I think a deep clean in a kitchen of a 5-star hotel in London. And they found a dead rat behind one of the ovens or something or other. And I just thought, oh my goodness, I'm never going to eat in that restaurant again.
It's quite useful working for environmental health, because if you're going out for the evening, it's somewhere you haven't been before, you just ring up the food officer and say, is that one all right? Am I okay to go there?
Yeah, you've got a good network of so hopefully you won't get any food related diseases.
Mind you, with the scores on the doors now, everybody at least can go out and have check what food score they've got before they go anywhere to eat. So it is pretty much open to everybody now. Yeah,
that's true. Which is a good trend, isn't it? I mean, I wonder if there's any other ways we can do that with other aspects of safety, actually, because I do think going back to COVID and sort of thinking of the silver lining on the cloud, I think one of the things is that the population has now got a great appreciation for safety and risk management. So I think there's an opportunity to capitalise on that and try to, you know, keep that front of mind, because that's to everyone's benefit, isn't it?
Yeah, absolutely. You know, I think, as you say, things have changed very quickly over the last couple of years, both with the technology that's available, the way we're doing things. I mean, we did 54 webinars last year, you know, mainly around COVID. We had about 10 of those that were totally sold out, with 240 people booked in to go on it. You know, I've booked health and safety sessions in the past that might have cost, you know, might have been funded and cost nothing. Nice swanky hotel, invited everybody. We've had 20 people turn up. You know, there's certainly going to be sort of different ways of sort of doing things and engaging now.
Yeah, the webinars. So I've done quite a few IOSH webinars, And before COVID, I attended not as many, but a few sort of branch or group physical meetings, and the attendance for the webinars is multiples of the people you get in a physical meeting, just because it's obviously much easier and more convenient, isn't it, to sit down.
I mean, most of the IOSH meetings that I would attend are an hour and a half drive each way.
Yeah.
It's far easier for me to go to a webinar, and I get far more out of it. I might miss the sandwich and a bit of networking, but ultimately, being as busy as I am, it's far better use of my time. And that's what businesses found. And also that we recorded it, we put it on social media so people could sort of watch it again. And, most of those webinars I did with a colleague of mine, and it was quite amusing because he was in the supermarket not that long ago talking to his wife, and somebody stopped him. I recognised your voice from the webinar. You're Mr. Ball, aren't you?
That's good. That's when you know you've made an impact in the world.
Absolutely. And we have had brilliant feedback from those, and we've done them for all the different sectors throughout COVID. So the holiday sectors, the hairdressers, the offices, the retail, and it's really done the council's reputation a lot of good, because we've engaged and they've seen the human face of us rather than what they spend a lot of time worrying about. You don't want to let the council in, they'll just come and do so and so, or they'll fine you, or not true.
No, exactly. That's good. Changing perceptions is always a great thing to achieve. Well, thank you very much for sharing your time today. It's been really, really great to speak and to get some insights and some lessons from you. Are there any kind of resources or plugs or websites or webinars or anything like that you'd like to share that the audience could hop onto and benefit from?
Nothing planned at the moment webinar wise, but if anybody wants to connect with me, I'm on LinkedIn, just Sarah Jane Brown, and usually I'll share any sort of webinars or anything we've got going on there. So that's probably the best way to find me. Yeah,
and if you're looking for a primary authority scheme, Cornwall Council.
For a primary authority scheme, do get in touch with Cornwall Council. It's something that we do very well, and we've got some dedicated staff to it and a lot of really happy, satisfied customers.
Great. Well, thanks again. I really enjoyed it, and thanks everybody for listening, and we'll see you again next time.
Thank you very much.